how to carry out an antigen test using the Panodyne Saliva Test Kit. Work on a clean, flat surface and disinfect your hands. The saliva test kit is bright orange and contains instructions, a cassette test, a sample collector, a pipette, an interpretation card, test tube with cap and a diluent. First of all, thoroughly read through the instructions. Next, open the cassette test and place it on the flat surface. Pick up the test tube and insert it into the designated holder on the test's box. Remove the lid of the diluent by twisting the cap, which should easily break off. Squeeze the diluent into the test tube and set aside. Now it's time for the saliva sample. Take the sample collector and spit a small amount of saliva into it. Extract a few drops using the pipette. Transfer the saliva sample into the test tube by squeezing the pipette. Place the cap on the test tube and shake it for a few seconds. Now your sample is ready for testing. Put 3 drops of the sample into the designated area of the test cassette. Wait until the C line appears to ensure it is valid. Set a timer for 15 minutes. Then interpret your results. A red line on the C and a red or pink T line is a positive result for COVID-19. A red line on the C only is a negative result. A red line on the T only is an invalid result, as is a test with no lines. To learn more about our COVID-19 test kits, visit www.rapidfiresupplies.co.uk.